I just wanted to make kind of half a comment, half a question to the panel around access to information and the sharing of information digitally. In the age of internet banking, internet shopping, internet everything, do you think the reluctance to share health information online doesn't actually come from the consumer or the patient, but actually from the healthcare professionals? Which raises kind of the comment earlier that although we need to instigate a behavioural change in the patient, we also need to in healthcare professionals and the system, the wider system.
I think that there has to arise at some point a standard platform that transverses across geographies and that we'll all use. It won't do everything, but it'll fill a need that allows primarily different stakeholders that currently are in silos in healthcare to interact in some way. And although it's incredibly complicated because there's so many different agendas, there's so much money involved in healthcare, and primarily the needs of an individual and their privacy and all of those things are way more complex than pretty much everything else. I do think that will produce, that there will be something that arises. And to answer the question, I think that only then will you really be able to have a situation where you can control your own record and you can exchange it with whoever you kind of choose to do so. And I just don't think that that's going to come from a government initiative to deliver electronic health records. It'll come from a very disruptive approach, and it'll come from the left field.
It's complicated. There's a lot of legacy infrastructure that costs a lot of money to replace, and no one's incentivized to financially be responsible to do that, make that change. That's what it's all about. So it's going to take individual groups who have a financial incentive to make it happen. Like in the US, there's Kaiser Permanente, which is a big self-funded insurance. They're one of the leaders in kind of electronic medical records because it's a self-contained system that they own and they can implement. So if we start looking for, again, those bright spots, looking for examples of where companies have made change and it is working, we need to figure out how to scale that. And it's going to take time. I mean, the banking industry still hasn't kind of got it organized. I mean, how many banking systems has 20 different legacy systems that don't talk to each other? But there's a financial incentive for them to make the change. And I think that's happening now in electronic medical records. But we'll see. Time will tell.
But Eric, what about the people who are digitally excluded? I mean, a lot of people managing chronic conditions are older people who've never had a computer in the workplace and are not online.
So here's the irony.
I know it's a temporary condition.
No, yeah, but we're all going to get there.
Yeah.
We're all going to get there. Here's the thing that's interesting. So you've companies like Google or Intel trying to set up these health vaults, but the problem is they put all the responsibility on that patient to put their data in there. But it's really the healthcare system, the doctors who are putting data someplace. I don't know where that data goes. They got little charts and it goes someplace. So wherever that place goes, that's the medical record. And why they don't share it amongst their own doctors and the pharmacy, I have no idea. But someplace, all that stuff needs to be stored, and then the patient can access it. So if if they're not technically savvy, so they don't access it. I mean, it'd be great if they can learn more things about themselves, they can be more proactive. But if they can't, but it's the healthcare professionals who don't. You go in an ER, someone has an injury, they fall down, they're rushed to the ER, they show up. The poor ER doctor has no idea who this person is, their health history, nothing. It's complete blank. It's like, are you allergic to penicillin? I mean, the person pulls this crumpled up piece of paper with that their niece wrote down by hand 3 years earlier with their medication regimen. That's what's going on right now. It's really like big delta between what it should be and where it is, and any little bit, even if it's a small scale effort, would be a huge benefit, huge effort, huge plus.
It's an interesting question though, isn't it? Will there ever be a pull coming from the HCPs themselves? I mean, I've seen data that shows that as a professional group, HCPs or medical professionals are a very wide adopter of new technologies like tablets and things like that. So, and doctors are getting younger and younger. I think in the medical field, the most senior doctors are the ones that are respected the most, and therefore, as time goes on, will you ever see something like an HCP Spring where you start seeing, actually, I'm just fed up and I would like something that makes my life a little bit more efficient and convenient, and, let's adopt this in a wider way.